Welcome to the State of Wyoming Subject Matter Minute, where we cover a wide variety of subjects related to State of Wyoming employment. This information is for you and me, the state employee. From hidden benefits to systems and processes, we'll make your job easier by giving you the lowdown, the how-to, and hopefully entertain you a bit along the way. And now, today's Subject Matter Minute. Hey, welcome to another episode of the Subject Matter Minute. I'm Matt Nagy. Thanks for joining me. Now, before I start this month's episode or topic, I wanted to mention one of the things that I really like to do. One of the things I do every summer, and sometimes kind of in the colder months, is river raft. One of my earliest jobs at the university, I just happened to work with a bunch of guys. It's just guys, I think, that were into river rafting, so they got me into it. I own a cataraft, which is not really a raft. It's, the type of the two tubes and the frame in between, which personally I think handles better in big rapids, but that's an aside. Recently, actually last week, I just got back from doing a river that doesn't really have a lot of rapids, or at least it didn't this year. It's the San Juan down in Utah. I've done a couple trips that we call the daddy-daughter trip on that river. And so basically it ends up being like 5 dads and I guess 5 daughters and 1 son this time. One son snuck in, but that's okay. And it was gorgeous. So I'm having a hard time getting back to work. It was a sunny trip. It was kind of chilly, but that just made the time around the campfire or the fire pan, for those in the know, so much more enjoyable. There was a lot of driftwood. We had a great time. So I know there's more of you river rafters out there, or river runners, and it's always good to know more, so feel free to post something down there or throw me an email. Never know what can come of it. All right, so this month's topic is health insurance for retirees. Okay, so before we do get started on this topic, I'd like to throw out another thank you to Karen Williams. She was my subject matter expert last time on the dental health benefits. So thanks, Karen. Okay, so this month's subject matter expert is Pamela Unruh, also of EGI. She's been very patient with me because I was peppering her with emails constantly, trying to get this figured out in my own head. Thanks, Pam. I appreciate your patience, and I think I got it all figured out. All right, so I had mentioned that it's retirees' health insurance is the topic, but really if an eligible retiree can also continue life, health, dental, vision, and long-term care, as long as they've had that coverage for at least 1 year. Hold on, I think I better clarify that. It's actually 1 year prior to retiring. So you have to have had the coverage for the last year prior to retiring. So the bottom line, something I'm going to be hitting on a lot here, is that you can keep these things when you retire, but the state contribution goes away. Now, there is a subsidy, but we're going to go into that later. Okay, so what makes you eligible? Eligible retiree, you can be under the age of 50 with at least 20 years service, or you can be over the age of 50 with at least 4 years service. Okay, one other little tidbit that you need to remember is that a retiree needs to apply for coverage within 31 days of the day that their coverage ends. So don't forget. All right, so let's talk a little bit about Medicare, because that definitely comes into play as you're reaching the age 65 or thereabouts. Once you become eligible, you must enroll in Medicare Parts A and B. That's because Medicare is the primary payer, okay? They pay first. The premiums for these coverages are taken out of your pension. Unless there's not enough money in your pension, then they come directly out of your checking account. Okay, I mentioned that the state no longer pays a big chunk towards your insurance, but you can get a subsidy. Okay, the subsidy is based on the number of years of service with, a covered entity. So that'd be like the state, the community colleges, UW, of course, and then some school districts. Okay, so currently the number is $11.50 per year for those who are not Medicare eligible, and it's $5.75 a year for those who are. Okay, now those both max out at 30 years, which means that if you're not Medicare eligible, you can get a subsidy of $345 a month if you've done 30 years of service. If you are Medicare eligible and you've had 30 years of service, that gives you a $172.50 a month discount. Now, I've talked about, hold up, the subsidy actually only applies to health insurance. So if somebody was retiring and they just elected life and dental, the subsidy wouldn't apply. Saving for retirement or retirement in a couple episodes, and this topic really ties in. Something a lot of people forget about is the shift of the burden of healthcare costs from the state to you. And that's a big shift. I'm going to go over a scenario here. And since typically when you retire, it's the retiree plus a spouse, my scenario is going to be retiree plus spouse at a $900 deductible. Okay. So currently, if you're an active employee at that, the total cost is $1,822. Now the state pays $1,660 towards that. So that leaves you with a monthly payment of $161.79. Okay. All right. So let's talk about a retiree plus a spouse that is not Medicare eligible. Their full price is the same, $1,822, but the state only pays the subsidy. They do not kick in the big chunk. So let's assume a max number of service years for the employee, 30 years times the $11.50, which means that they can take off the top the $345. All right, so that puts their total monthly payment at $1,477.04. So your healthcare costs just went from $161 a month to $1,477. That's a difference of nearly $1,315. Now you finally paid off that house, but you've got a whole new payment to deal with. I'm not trying to upset anyone, and I don't want to be flip about this. I just hope that this information can help people who still have time to save more and take these things into consideration. Okay, so let's talk a little bit more about Medicare. You can simply drop your state health insurance when you become Medicare eligible. Okay, I don't know what kind of coverages there are or how good they are, but if you don't feel like it's enough for you, then you are going to pay more, even when you're both Medicare eligible. Okay, so the next scenario would be a Medicare eligible retiree and a spouse who is not eligible. Okay, so they pay $1,365.71. Let's assume the max number of years of service. Okay, now remember the employee is eligible. That means that they can get the $172.50 from the monthly total. That puts the monthly total at $1,193.21. So in that scenario, you will still be paying over $1,000 more than you were as an employee. Okay, that scenario was a Medicare eligible retiree with a non-eligible spouse. The final scenario, obviously, is you're both eligible for Medicare. Prices do drop at that point, but you're still going to be paying nearly $600 more a month than you were as an active employee. All that being said, there are some higher deductible plans that can bring down your costs, and there's also some Medicare supplement type plans. I've posted a link below to the charts, and you can see those on there. Basically, what the Medicare supplement plans do is they help with the out-of-pocket costs of Medicare, and they're much cheaper, but you're not getting all the benefits of the health insurance. Okay, so the bottom line in all this is that you can keep your coverages when you retire. However, your costs will go up. Just keep this in mind as you save for retirement and perhaps as you consider what age to retire at. All right, hopefully I haven't made everyone depressed or scared. And hopefully you either knew this and you're prepared, or you have time to save more money or shift your expectations about when you're going to retire. I think that's it for today. Thank you very much for joining me, and I'll see you next month on the Subject Matter Minute. You have been watching the Subject Matter Minute with Matt Nagy. Please help us out by subscribing. And join us next month when we'll cover another topic of interest for all State of Wyoming employees. Again, thank you for joining us on the Subject Matter Minute.